Hello everyone, I'm Kesika Ahnathaarao, currently doing 3rd year in Bachelor of Science in Biochemistry. In this video, we are going to discuss about current research and practices in cancer treatment. In this world of science, there are many types of cancer treatments that exist. Cancer treatments are to cure a cancer, shrink a cancer, or to stop the progression of a cancer. When you diagnose with a cancer, it is important to choose the right treatment after the discussion with your doctor. Choosing a suitable treatment depends on many criteria: type of cancer, stage of cancer, the age, the general health, and also individual preferences. For a particular cancer, sometimes one treatment is sufficient, but sometimes it's required to receive a combination of the treatment. For an example, for breast cancer, after the surgery, it is advised to undergo chemotherapy as well to stop the progression of the cancer. Now, let us move on to the next part, which is current practices in cancer treatment. There are commonly 7 types of cancer treatments available, which are surgery, chemotherapy, immunotherapy, radiation therapy, hormone therapy, targeted drug therapy, stem cell transplant. The first cancer treatment is surgery. The goal of surgery is to remove the cancer or as much of the cancer as possible. To do this, the surgeon uses cutting tools to remove the cancer and some healthy tissues around it. The surgeon may also remove some lymph nodes in the area after testing it to see if they contain the cancer cells, because lymph nodes that contain the cancer cells can contribute to cancer metastasis. What are the techniques used in cancer surgery? Cryosurgery, electrosurgery, laser surgery, Morse surgery, laparoscopic surgery, robotic surgery, natural or synthetic surgery. The second cancer treatment is chemotherapy. What is chemotherapy? A medication that kills your body's rapidly proliferating cells using strong chemicals, which is technically a chemotherapy drugs will be injected inside our body to kill the cancer cell. Okay, how does that chemotherapy drugs will be delivered inside our body? First, through intravenous chemotherapy, which is through our vein. Second, oral chemotherapy, which is through our mouth. Injected chemotherapy is a traditional chemotherapy, and chemotherapy into an artery, chemotherapy into a peritoneum or abdomen, and lastly, topical chemotherapy, which is a cream-like chemotherapy where we will be treating skin cancer. What are the chemotherapy drugs available? First, alkylating agents, antimetabolites, anti-tumor antibiotics, topoisomerase inhibitors, mitotic inhibitors, and plant alkaloids. The third one is radiation therapy. High-energy X-rays or other particles are used in radiation therapy as a cancer treatment to kill the cancer cells, which is technically charged particles from outside resources will be injected inside our body to kill the cancer cells. There are many types of axial beam radiation therapy. 3-dimensional conformal radiation therapy, which is called 3D CRT, intensive modulated radiation therapy IMRT, proton beam therapy, which is will be using positive charged as a charged particle, image guided radiation therapy, and lastly stereotactic radiation therapy. During this CRT, that person should be very in minimal movement. There are 3 types of radiation therapy. Firstly, neoadjuvant radiation therapy, which is the radiation therapy will be given before other treatments to shrink a larger tumor. Secondly, adjuvant radiation therapy, which is the radiation therapy will be given after any other treatments to destroy any other remaining cancer cells. Lastly, palliative radiation therapy, which is to relieve the signs and symptoms of cancer. Radiation therapy can also used to treat recurrent cancer and metastatic cancer. The fourth one is immunotherapy, technically which means to boost our immune system. It uses substance made by the body or in a laboratory to boost the immune system and help body find and destroy cancer cells. There are 5 types of immunotherapy. First, monoclonal antibodies and immune checkpoint inhibitors. Second, non-specific immunotherapies. Third one, oncolytic virus therapy, T-cell therapy, and the last one is cancer vaccines. Let me explain more about the types of immunotherapy. Firstly, monoclonal antibodies. Monoclonal antibodies are made in the laboratory to boost the body's natural antibodies or act as an antibody themselves. They are considered as targeted. The last cancer treatment that we are going to discuss in this video is hormone therapy. What is hormone therapy? It's a cancer treatment that slows or stops the growth of cancer, which uses the hormone to their growth. 2 main reasons why we are using this hormone therapy is to treat the cancer and to ease the cancer symptoms. The commonly treated cancer for this hormone therapy is breast cancer and prostate cancer. How it works actually with the other treatment is, firstly, it will make a tumor smaller for other treatments such as surgery and radiation therapy to act on effectively. Second is to lower the risk that cancer will come back after the main treatment, which is called recurrent cancer. The last one is to destroy cancer cells that have returned or spread to other parts of your body. The existing treatments all can't be said fully effective, and they're effectively decreasing the mortality. It has its own limitations and side effects. Therefore, researchers working hard to find effective outcome in each treatment. In that case, let us discuss the recent research done on a particular treatment. The research number 1 is about immunotherapy. The problem is majority cancer patients are still non-responsive to the immunotherapy, or they are rapidly developing therapy resistance. So why does this resistance develop? So before moving into the findings, let us discuss about the background research first. Preventing and reverting the attacks, which is the exhausted CD8 plus T cells, is the primary goal of cancer immunotherapy. Okay, now what is CD8 plus T cells? It has anti-tumor effector functions. Therefore, the immunotherapy effectiveness is only 20 to 30% due to the terminal development of tax resistant to the immunotherapy. Now the question is, why does this resistance toward the tax in the terminal is developed? So let's move on to the research findings. The researcher team has found that through this finding, chronic type 1 interferon, which is IFN1 exposure, has shown a negative impact on this tax development and immunotherapy resistance. The chronic IF1 signaling has promoted the lipid peroxidation. This drives the CD8 plus T cells for a fake commitment towards the terminal exhaustion. This lipid peroxidation is accumulated in this therapeutic resistance as well. So what is the significance through these findings? We can conclude that we can use the harmful IF1 LOPO pathway as a biomarker to guide the patient's treatment regimens. So we have found the new approach, which is IF1 blockade, can improve the efficacy of immunotherapy. But further research and findings should be there to increase its efficacy of these research outcomes. So who did come up with these findings? The researcher teams from the LKS Faculty of Medicine, the University of Hong Kong. It has published in 15 November 2022. So that's all from me. Thank you.